Hello, everybody. Can you hear me okay? Get a couple of thumbs up if I can. Good to see you, whether you're on screen or good to see your names and have you. We've had several of these in years past coming into open enrollment, and we've never had so many people interested in registering, and we expected that because healthcare and health coverage is a pretty significant topic and issue, and something that each of us need to have and to work with. My name is Duncan Smith, and I'm the director of the Corinthian Plan. I've been doing this for a lot longer than I ever expected, but I'm in my 12th year. And I want to introduce some other folks that are with us. Patrick Tibbs. Well, as you know, let me step back just a little bit. Everence is our third-party administrator, and so they are a very significant partner in the Corinthian Plan. And Patrick Tibbs is going to be here to help us to work with part of the seminar. And Denise Henke, you maybe talked to Denise, or you maybe have never seen her picture, but she's somebody who works with the plan very closely. And then Ingrid Friesen Moser is our wellness coordinator. So they'll be helping to share during our time together. Also on the call are Teresa Pickens and Joe Christoffel. Some of you have talked to them. They are area advocates for the Corinthian Plan. And Dina Roth, who works along with Denise and takes phone calls and works with issues. So have been a wonderful team for me to work with. Everence has been a wonderful partner to have and to do this work. Very appreciative. They really help with the keeping everything in line, but also have a heart for the church, and so I appreciate that. I'm going to work with a few logistics. We chose to keep this more in the town hall type of format, so we're all in boxes. You'll have to adjust for speaker mode if you want to have the person that's speaking come up large on your screen or not. So just so you know that. You are all muted. We are taking questions in the chat, and the chat, if you haven't found that yet, or not the chat, but the Q&A is down at the bottom on the right. There are three dots and it says more. So if you go to more, then you can find the Q&A. So please put your questions in there that you would like us to respond to. I've received questions from many of you, and I expect we'll cover most of those along the way. But if the question you asked before the webinar wasn't answered, then please let us know. We are recording this session, so because we're in this format of Zoom, we are also your boxes or your pictures are seen. You can choose to be on screen or off screen, of course. And then we will be dropping some information either into the Q&A or into the chat box. We'll be dropping some information along the way, and we'll also be sharing screens. I think that is the basic of the logistics. Just a couple of comments about the Corinthian Plan. We are sponsored by Mennonite Church USA. I am Mennonite Church USA staff. Ingrid and Teresa and Joe are contract staff with Mennonite Church USA. Patrick, Denise, and Dina are staff of Everence, the third-party administrator. We use Highmark as our provider and claims system, Highmark Blue Cross Blue Shield, and then Express Scripts as a pharmacy benefit manager. We are self-funded, which means I like to say we're self-contained, which means all of the premiums and such are what fund us. So we're self-funded, we're a church plan, and we're employer-based. So many of you here might be representing the congregations and be the employer, and others of you might be the participants, pastors, and staff. So we wanted anybody to be here as much as possible. We also welcome those that are not participants, and I'll talk about that in a minute, because the first half of our time together basically is looking at health coverage within the United States. I think I'm going to leave it at that. We're going to have to um, recognize that we're not going to get into the weeds on everything. And so some of your questions we may want to respond to or work with beyond our time together, as you may have questions about the plan that are very specific. Some of this is going to be high level. Some of it, when we talk about the plan changes and what's coming in 2026, will be more specific. So I think that's enough of an introduction. The purpose here is twofold. The first part, we will look at the health coverage industry in the United States and the pressure points that we and others are facing. And the second part will be focused on the Corinthian Plan. So you might want to stay for the first part or the first part and the second part. That's up to you. So at this point, I will turn it over to Patrick Tibbs, and Patrick is going to help us with the current context of United States health coverage. Patrick.
Thank you, Duncan. Good afternoon, everyone. We're going to share some slides here in just a moment, but it's good to be with you. Again, my name is Patrick Tibbs. I'm the Operations Manager here in our third-party administration. I oversee day-to-day operations for health plans that we administer, reviewing, overseeing processes, make sure they run smoothly and that compliance is maintained, and clients like the Corinthian Plan, have reliable support from our team and help support you in your work on a daily basis. So, Denise, are you able to share your screen? There we go. Nope. Yep, that one. Thank you so much, Denise. Okay, so again, what we're going to do is I'm going to walk through a high-level overview of the current state of healthcare and try to look forward a little bit as to some of the key trends, cost drivers, and just some observations of what to expect in the coming years. Next slide, Denise, please. So let's start with the big picture. Healthcare costs continue to climb. Premiums are up double digits across most of the marketplaces, meaning employer plans, which they have been the steepest this coming year than they have been in about 10 to 15 years. Healthcare premiums are increasing at exceeding general inflation. So when I say general inflation, I'm meaning just the cost of goods and services, things that we're paying for at the grocery store, things of that nature. And employer-sponsored plans are seeing double-digit type of hikes, and the ACA marketplace or exchanges are projected to rise 18 to 22% in 2026. Key drivers of these increases are specialty medications, specialty drugs. So a specialty drug is a high-cost medication used to treat complex, chronic, or even rare diseases such as cancer, multiple sclerosis, HIV. They often require special handling, and they're likely administered with an injection and then ongoing monitoring from a provider. Though they represent a small share of prescriptions, they do account for a large portion of total drug spending. Other cost drivers are services for behavioral health, labor shortages in the healthcare industry, and then also provider consolidation. So a lot of these factors that are driving up costs, healthcare costs and premiums, are creating a strain on budgets, obviously for everyone that participates in the healthcare system. Next slide, please, Denise. So what you're looking at is a graph that it really demonstrates what's happened with the cost of employer health premiums, and this has been over a 10-year period compared to general inflation. And obviously, as you can see, it's really taking off, especially a year or two after COVID, around 21 or 22. There was some high inflation during that time last year just for general type of services. But as you can see, healthcare premiums are about 3 times that of what the general inflation rate is. And that trend, unfortunately, is going to continue from what we know for the next several years. Next slide, please, Denise. So if we take a look at the legislative landscape, back in July, the One Big Beautiful Bill Act was signed into law, and that introduced some sweeping changes to healthcare funding and eligibility. It includes the expiration of the Affordable Care Act enhanced premium tax credits, which those are scheduled to expire at the end of this year, which much of the conversation going on in Washington right now with the government shutdown and some major cuts to Medicaid over the next decade. So these changes are expected to result in about 10 million less or fewer Medicaid enrollees by 2034, which is going to put a huge burden on community-based providers, especially in underserved areas. Next slide, Denise, please. Thanks. So since the beginning of President Trump's term back in January, I think we've all seen or read about the tariffs that have been imposed on goods and services across the globe. Those are actually affecting healthcare supply chains and pricing. So this includes a 10% global tariff on imports and almost a 250% tariff increase on Chinese active pharmaceutical ingredients or APIs, which a lot of the medication that we do receive here in the United States is produced outside of our country. So this will have a dramatic effect on prices and medical devices that are produced in other countries, such as Canada and Mexico. So these tariffs are increasing drug and device costs, and disrupting supply chains and contributing to higher premiums. Next slide, Denise. Thank you. So all of these changes, what's happened legislatively and tariffs are having an impact on rural healthcare providers. There will be a lot of challenges here in the next few years. Nearly half of rural hospitals are operating at a financial loss due to outdated infrastructure or workforce shortages, and a shift from inpatient to outpatient care. So there are some federal support programs that have been designed to be put into place for this, but there are delays, obviously, in this new legislation that was passed last July, and with the government shutdown, yeah, not sure when some of these funds are going to reach some of these rural healthcare centers. So, as you're probably aware, the federal government has been shut down now for several weeks. Nearly half of the Centers for Medicare staff were furloughed, and which is obviously slowing operations and access. Funding gaps in SNAP, Head Start, WIC programs are impacting. um, members across the country. Medicaid disproportionate share hospital payments are being, which are reduced, are impacting hospitals. So, which is could be driving up emergency care, which could drive up healthcare cost. Um, the Democrats, if you've read or seen any of the news covering this, they really are trying to um, not reopen the government until Republicans would agree to extend the ACA tax credits. What I've heard is maybe for 1 year, and Republicans are really not entertaining that idea. So more to come on that from what I've read and the sources that we have here at Everence. It's very possible that the shutdown could last another several weeks. So just in closing and just the outlook, for healthcare costs and spending is that medical cost trend or what the trend or the inflation of costs for healthcare is going to rise by at least 9% in 2026 for employer-sponsored group plans. So that's going to contribute to increased premiums and rates likely for next year. Healthcare spending alone will be more than 3 times the annual federal deficit in 2033. And this is putting a stress on public health infrastructure. Again, if you've been following anything that's been happening with the CDC, there's been a pretty big reduction in the CDC, a big reduction in the National Institutes of Health, which are threatening, emergency preparedness, chronic disease programs, changes in the vaccination guidelines. So just a lot of change that are going on, which we likely will see some impact in the years to come. And then something that I haven't touched on, but I'm sure we could have a pretty long discussion about is just the technology and innovation that's coming. If any of you have used AI or read about it in automation, there are high hopes that it's going to offset some of the workforce type of shortages in healthcare. Um, there's been a pretty big shortfall for a number of years for nurses and healthcare staff. So a lot of care going forward from what we see will be virtual, meaning you'll be maybe not necessarily visiting with your primary care provider in person. You'll be using AI to, really um, help with your healthcare needs. So just a lot of things in the future, I think, which will help with care and then also try to reduce some costs.
Thank you, Pat.
Thank you.
I don't see any questions in the chat. If you want to raise your hand, if you have any questions here.
Duncan, I can read them to you. The first one is from Kathy Neufeld Dunn, and the question is the Corinthian Plan back in the Kroger family of pharmacies?
Is back what in the
Is the Corinthian Plan back in the Kroger family of pharmacies?
um, Pat, can you there
Yeah, I can.
with Express Scripts? So yeah.
I can take that. So, right, Kroger had decided to leave, and its affiliated stores had decided to leave the Express Scripts network several years ago. They have recently made an arrangement with Express Scripts to come back in. We're still evaluating whether or not that is something that we would offer, just from the standpoint that Kroger has said, and we do know from Express Scripts that Prices for prescriptions through Kroger with Express Scripts are going to be higher than they were before when they were in the network. And it would also require a plan to then either choose to have CVS Caremark, CVS pharmacies, or Walgreens. So we would not be able to keep all three as a choice for a network pharmacy. So we're still evaluating it, but we'll be updating Duncan here in the near future on that.
The next question is from Lana Miller. And the question is, can you speak more to the Corinthian plan in particular? Why are the plan rates so much higher than other plans? Does this connect with the fact that the plan is self-funded, as Duncan noted in the beginning? Or what factors keep this particular plan at higher rates?
So the second in a minute, well, we can move right into working with the Corinthian plan pretty much and respond to these questions. So the pressures that Pat described all affect not just the Corinthian plan, but all across the industry. So it's a hard question to answer in the sense of what are we comparing to? I do know that with the enhanced tax credits, the ACA can offer some really good premium cost prices. But we always have to look at what we're comparing across the board. We are a small plan, so that does affect how we do our rating. And we have to make sure that we do have the funds. There's not an issue. We're not going bankrupt, but we have to make sure that we're in good shape financially. So I think to better answer that question, one would have to kind of know what we're comparing to. At this point, the Corinthian plan with the new setup that we'll talk about in a bit with the new deductibles, the Corinthian plan with the 3.6 deductible is a gold comparison to the ACA because we haven't changed our deductibles until now, except we added a 4.8, and then the higher deductible that will be the second deductible option now is a silver plan. So again, it's hard to respond. I also get responses that our rates are very competitive. So that's why the question is hard to answer. I'd be glad to entertain a conversation by email or talk about that just for the specific situation that you're talking about. And Pat, if you want to add anything.
I would just say, Duncan, that rates going up are just not specific to the Corinthian plan. We see it with other clients or other pools of institutions, Anabaptist institutions that we work with health insurance, that their rates are going up, and then more broader with the Church Benefit Association of organizations, which the Corinthian Plan and Everence are part of. There are very large organizations that have health insurance there that are thousands of lives that are experiencing the same thing that we are as far as just increased costs. And I would just say that the marketplace is on track to go up, as I mentioned, 20% or higher for rates.
Right. And when you hear the folks talking about the 75% and higher increase, that's when people lose their enhanced tax credits, the subsidy support that they've had. So that you put the two together, you put what Pat just said, the basic increases that are there, and then those. So that's, again, it's not to depend, but enough experience over the years is that it's sometimes just hard to compare. I'll go to one of the questions that I was also asked before this meeting had to do if we've ever explored with joining with other pools so we could be larger. And we have had those conversations. It seems to be hard for people to move out of their territory. So we may continue those conversations because if we were a larger pool, it would be helpful. Yes. Cami, was there another question? Third question?
No, I'm sorry, I misspoke. That was it too.
Okay. And I put something in the, I guess it's in the Q&A when Pat was talking about the ACA. The ACA doubled in enrollment after the enhanced tax credits were put in, the enhanced subsidies from 12 million to 24 million. And a bulk of those increases were in states that had not accepted the Medicaid expansion. So that's part of the the harm or the difficulty that's going to come with the Medicaid cuts as well that Pat was referring to. Okay, well let's move on to the section on the Corinthian plan. So if you have questions, put in the Q&A more about the Corinthian plan. A lot of the pre-webinar questions that I read had to do with what are the changes, what are the premium increases, and so on. So we want to get to that. We want to talk about that. I'm going to speak to a couple of questions. We also have some information kind of broadly about the plan that may or may not be helpful. I'm going to kind of gauge where you're at as best I can as far as what your needs are. So I really encourage you to put any comments or questions in the Q&A where you would like more information. But a couple of pre-webinar questions that I received had to do with subsidies. Our premium increases are significant this year, so I do expect that there will be more uh, interest and inquiry about subsidies. So yes, our subsidy program right now is is about even and in good shape. I want to wait until I see the inquiries to see how we can do, but we haven't changed that information or the guidelines at this point. So if you have any interest in that, you can send questions or comments to me. I can send you the subsidy information if your congregation is facing challenges in paying the full premium. And again, we'll get to that, but we know that the premium increases are going to be a challenge and difficult for congregations. We want to be fully disclosive about that. Second question had to do with basically the grandfather guidelines. It had to do with what if congregations are not MCUSA congregations. In particular, there's a lot of talk and conversation around whether Mosaic is going to stay in Mennonite Church USA. So the Church Benefits Board that oversees the Corinthian Plan has very broad grandfather guidelines that welcomes congregations that actually, as far back as the merger in 2001, where members would be eligible to enroll in the Corinthian Plan. The one caveat there is that congregations that are not participating in the Corinthian Plan and are non-MCUSA have no open enrollment and have to go through medical underwriting. So there's no open enrollment for non-MCUSA congregations. If they're participating in the plan, then they have full benefits at this point. So wanted to make sure that everyone understood that. Another question had to do with eligibility. So to be eligible, you have to be a pastor or staff person of a eligible congregation. So it could be a grandfather congregation. Again, you'd have to go through medical underwriting if you're not currently participating. You're part of a non-MCUSA congregation. But congregations to be eligible for non-credentialed staff, it's 3/4 time or 0.75 FTE, and for eligible staff or for credentialed staff, it's 0.5 or half time FTE. So the eligibility right now, this is part of the reason our plan's small. It's not for anybody in the congregation. It's for staff persons of eligible congregations. So those were some questions I received before the webinar. Okay, so let's look at the changes. And Denise, if you could put up that screen. So every year, the Church Benefits Board that comprised of folks that are appointed by Mennonite Church USA meets in September. They meet twice a year, but the September meeting is when rates are set. And the goal every year is to project medical costs and to project what our current context is within the Corinthian plan, and then to set rates. In the past, we have always tried to keep rates at about a 5% or below base rate. So a base rate is what everybody beginning premiums are based on, and then age, gender, and location are different. So the base rate then you add on just a little bit. So I'll come back to that. But the Church Benefits Board really was challenged this year. We were challenged as staff and as a board to look at our current context and to look at ways to go forward. And this is what we came to as far as something that um, is actually even a little lower than what we were basically looking at, and also just working at different ways of formatting the plan. So our base rate increase is large. It's 19.9%. So when your congregation receives the premium increase, it will include that base rate, and then it will include the increases of persons getting a year older, and any changes in gender or location that are based on that. So the increases will be likely for most above that 19.9%. So full disclosure, it's difficult for congregations. That's why I also want to talk about the subsidy program, so that we can continue to seek to provide access. Now, we'll talk in a little bit about when congregations get their premiums. We know there's going to be sticker shock. We know it's going to be difficult. And many congregations, as they do every year, will probably go and look in other places. So we want to talk about some things to think about when you compare, when you go ahead and do that. Deductible options are changing. So we previously had four deductible options, beginning with 1650, 1,650 single, and 3,300 family, then 2,000, 4,000, 3,000, 6,000, 4,000, 8,000. So we are simplifying our options. The lowest deductible also had an embedded and non-embedded plan. So that's why you see we are streamlining from 5 to 2. So we're moving to a 3-6 option, which a majority of our congregations are on, a high majority. And then we're going to have a 5-10 option. The 3-6 is a non-embedded and the 5-10 is an embedded. So these are slightly different. We can come back to some specifics if you want to talk about that, and we have time in the Q&A. There are a couple of, well, there's one link for a summary of changes. So the summary of changes will give you some more specifics about the difference between the embedded and non-embedded. So I want to move on at this point, and then we can come back to that. We are also adding a co-insurance. So we know this is kind of another gut punch a little bit, but we're adding a co-insurance for participants beyond the deductible. So when the deductible is met, then the plan will begin paying 90% for the next 10,000 of a single, and 90% also for the next 20,000 of a family. So there's additional potential cost, out-of-pocket cost of $1,000 for single and $2,000 or family. All right, Denise, go ahead and move on. We can entertain questions. So Pat already went over these. One of the things that he did mention in passing is we have had higher claims experiences over the last 2 years, so than usual. Our claims experience has actually been pretty good, but we've had higher than usual, and that's, we're here to pay that, but we're also working with that little change of the landscape and see if that's a blip in the screen or if it's a more long-term change in the landscape. So Pat's gone over those. We can move on. We are starting with a little bit of a new program for GLP-1 drugs. GLP-1 drugs have are used by many folks across the land, and they're very helpful. But we're working with a little bit of a change with Express Scripts on a program that will provide a little bit of accountability, and this will be for both the diabetic and the weight loss drugs. Anybody on GLP-1 will be getting that information in the mail. And Pat, do you want to?
Yeah, just to say
Yeah.
that members who are currently taking a prescription for GLP-1 for weight management, they'll be contacted sometime in the next month or two as to the program details. But if for any reason, a member has a question, they can reach out to us and we can be sure that we walk them through the process in the program.
Thanks, Pat. All right. So if you're looking for other coverage, I talked a little bit earlier about apples to apples, and it's often hard to do. My wife went to the exchange for a little bit, and when she was there, I mean, it's difficult to parse out exactly what the coverage is in many cases. But here's some questions to ask. Is the coverage broad or limited? Sometimes there is very limited provider network, for instance. How extensive is the provider network? But also the coverage could be more limited. So just know your coverage, know what your provider network is. Is your current primary care physician in the network? All of those questions are just important. What are the deductible options that are available? Are they very high? Does that fit for your current medical situation? What's the maximum out-of-pocket cost? As we're just looking at our out-of-pocket costs. With the Corinthian Plan, folks on the health coverage are required to take life and disability benefits, and because we do that for everybody, those costs are fairly low. But are there any life and disability benefits? Do you value those? And then are there vision and dental options available? We have vision and dental available. The vision program is really excellent, and dental program provides good benefits. So it's really important to I think we have to slow down a lot of times and just take a look at what you're currently getting. If you have any questions about that, you can call us. We understand that you might be looking or not, so that's fine. We're willing to answer those questions, and then maybe we can also offer a little more specific information about what your current coverage is. Pat, do you want to add anything to that?
Oh, sorry, Duncan, I had to unmute there. So, right, I think it's really important if you're looking at other options, considering the Corinthian Plan, or you're currently participating, that in your research, if it is the marketplace, or even when you're comparing to another employer plan, I think Duncan has provided some good information for you to compare. With the life and disability, the dental and vision, the wellness program that's been in place for several years. I think those are really great added benefits for the Corinthian Plan that don't exist necessarily with other employer plans and not the marketplace. So,
Thanks, Pat. So please add comments or questions to the Q&A. A couple of other comments, and then we'll move on to the wellness incentives. Just a reminder that this program began in 2010. It was mandated by the delegates in 2007, and the purpose of the plan was at a real point of crisis. We are perhaps entering that again in the health coverage industry. We're certainly at a difficult point for the health coverage industry, but for individuals like yourself and for congregations. So just a reminder that you're sharing in this plan with other Mennonite Church USA and beyond congregations, people that you know, and that all the costs are shared evenly across the system. So we are also sharing together in that premium increase, which is difficult. So I just want to remind you of the purpose of the plan, and we do everything we can as staff and as a board to provide uh, as much flexibility, but also support in your coverage. All right, Ingrid Friesen Moser, you may have had contact with her. She's the wellness coordinator for the Corinthian Plan. Hopefully you have participated in our wellness incentives. We are making some slight changes, but they won't come until next March, but I'll let Ingrid speak into that.
Yeah, it's great to be with all of you this afternoon. If you have participated in the wellness incentives in the past, I'm really glad that you have done that. If you haven't, I just want to make sure that you know about the opportunity that you have. And wellness has been an important part of the program. It was a part of that initial piece that the Corinthian Plan felt was important when it began 15 plus years ago. And so it's been integral to what's been on offer. There is available for each person on the Corinthian Plan a $300 wellness incentive. If you have a spouse, that spouse is invited to participate with you, whether they're a part of the plan or not, and that is a component of the incentive for this plan year. The wellness incentive cycle runs a little different than the calendar year. We run a little off so that it doesn't match up and make an overburden for our Everence staff at the end of the year with enrollment. So you have until the end of February to participate in the wellness incentive cycle that is currently on offer. And you can get $150 for doing an annual wellness exam. And you just need to let us know that you've done that. There's some forms available on the Corinthian Plan website that you submit into us to let us know that. You can earn a second $150 for one of our 4 action steps that we're offering in the current cycle. And that's either to do a conversation with one of our well-being specialists. We hire our own well-being specialists. They are spiritual directors that are within the Anabaptist network of spiritual directors. They're people that know well issues for pastors and pastor families and people that work in churches. So we've had lots of great feedback from conversations that people have had with them. Another option is to do a well-being retreat. So this is something you can plan and schedule yourself. Just let us know what you did and what you found the benefits were on that. And there's a form for that too on our website that will let you be able to submit that for your $150 reimbursement. This cycle, you can choose to do a personal wellness plan, which is something you create and write up on your own and submit to us. We have 4 conferences that have pre-approved conference accountability plans, and those are Central Plains, Indiana, Michigan, Pacific Southwest, and Western District. So if you're part of one of those area conferences that has a pre-approved plan, you can do that. Again, the date that you want to get all that in and done to us by is the end of February. And the sooner you do it, the better, especially if you're looking to schedule with one of our well-being specialists. Get that on your calendar and get that booked with them. That way you can have a chance to do that. As Duncan mentioned, there is a need to do some streamlining and some refining in order to keep the wellness incentives something that we have on offer for Corinthian Plan people. And in the coming cycle that will begin March 1st in 2026, the incentive will be available to people on the health plan, that's the employee as well as the spouse, if the spouse is on the plan, and to waived employees. So we will be limiting the benefit to spouses, which was an additional benefit that we were able to offer in the past, but currently we'll be scaling back on that part of it. And we will also be streamlining some of your activities that you can do for that second 150, that action step. We'll be continuing to offer the retreat as an option and continuing to offer the conversation with the well-being specialist. I was really grateful that the board could have chosen to eliminate all the wellness incentives given the current cycle of things. And I had prepared myself for that, but was really grateful that the board chose to see the value in offering it and found some creative ways to continue to keep this as a benefit to Corinthian Plan people. So if you have questions, let me know. And you can find a lot of good information on how to participate on our website. The one last piece I want to mention is something that's specifically for congregations. We have a tool that congregations can take advantage of. It's a cultivating congregational well-being tool. It's something that you can use to reflect back on what are the types of things that we can offer as a congregation to our pastor and church employees, and reflect on some different components of well-being for your congregation. It is a tool for self-reflection. It's a tool to hopefully simulate some conversation and some other creative ways that you may be able to support your pastor. We know that there are a lot of churches out there that may not be able to offer as many benefits as they would want to offer because of financial struggles or difficulties, but there are creative ways that congregations can offer things like, how could we maybe offer you some respite care if you're taking care of older parents or children? Or can we think about creative ways that we may be able to make housing affordable if our congregation is in an area where housing is really expensive? Or what are things that we could do when we have congregational gatherings that might help just create more of a well-being environment for our pastors? Or can we offer standing desks? Can we offer ways to think about how we offer meetings? So I hope you might take a look at that tool and think about what your church and congregation might be able to do to support pastors and to support your employees. I think I'll leave it at that and take questions if there are questions that people put in the Q&A or the chat.
Couple more questions. Thank you, Ingrid. And Ingrid is a registered dietitian, so she brings that sort of background and works at a clinic in Goshen.
Mm-hmm.
So a couple more questions. Heidi Kreider asks, why are credentialed staff and non-credentialed staff treated differently? This is definitely a question that comes up periodically with our board. This is the plan was set up with this differential in part because of congregations, multi-staff congregations, maybe being challenged to cover all of their staff even above half time. So a reminder that non-credentialed staff are covered at have to be 0.75 or 3/4 time, and credentialed staff at 0.5 or half time. We have an exception policy that if a congregation or a conference office uh, has a agreement to cover all of their staff at 0.5 or above, then we grant that exception. We have talked about making that change and have currently decided along the way not to make that disruption for congregations. I don't know if Pat has any more history on that or not. It would be more even to have everybody eligible at 0.5. So it's a good question, and one that I doubt the board is I think will continue to work with. And Tori Long asks, she's saying we have a lot of staff transition in 2025 and anticipate a new pastor making assumptions about our budget, about benefits. When do I get our up-to-date census status? So that's a great question. Um, we are working on, and Everence staff in particular are working on so many different changes to documents that the renewal packets will be coming out hopefully next week. But we're really challenged in that. So if you want your current quote for your congregation, you can send an email. You can send it to myself or to Denise, and we can put that information in the box there. So, and any questions you have about current coverage or anything like that, it's available. It's just that we don't have those the physical packet out yet. Are there other questions? Not seeing any. Cami, do we have anything else?
Yes, Johnny Rashid is asking, could a change in the political circumstances change premiums and deductibles for this year? Apologies if you already answered this.
It's basically all the pressures that Pat talked about. We've talked about along the way, Johnny, are what is putting pressure on us, plus our particular circumstances of having high claims over the last 2 years. We don't. It should not change any of our coverages or anything like that. So that's an important point to get to. That all of the coverages will remain the same. The changes are basically in the deductibles and the premium. Yeah. Does that answer that? Can you be more
Kind of.
specific? Yeah, can you be more specific?
Like there's a conflict right now in Congress and it's related to
Yeah,
healthcare. If it goes a
right.
certain way, could the premiums be lowered? That's what I'm asking. You feel me?
Oh, no, no, it won't affect us.
It won't affect us because this
It
is
will not
done.
affect
It could
the
affect us
Corinthian
like
Plan.
next year perhaps or something.
It depends as much on our own circumstance. Basically, what it would do, my observation is what it's going to do if, let's say, Congress does extend the tax credits for the ACA,
Mhm.
then the ACA costs for many people that were on those enhanced tax credits will be better. So if in relation to the Corinthian Plan, there's an impact, but it does not
But the
affect.
Corinthian plan won't change. I hear you.
No, we're kind of our own bubble. Yeah.
All right. Thank you.
Mhm.
Thanks a lot. That's really helpful, Duncan.
Yeah, and thank you for following up because I want to get those questions answered. Good. Yeah.
And then someone asked if Ingrid could supply the wellness plan details in writing.
So are you asking to have them sent to you, mailed to you?
With
Susan, I
Langford.
put that in the chat and it's already appeared in the chat, so I've got it. Thank you so much.
Yeah, good, good. And if you have questions, reach out to me or
Thank you.
Denise and the folks at Everence are also really great. So let us know how we can help you.
Appreciate that. Thank you.
And for those of you that are here as congregational reps, please encourage your staff to take advantage of the wellness incentives. I'm putting the information for Denise and myself. So if you want an illustration for your congregation, then please contact one of us and we can send that on to you. And for those of you that might be in a congregation that has a subsidy, I'm a little late in getting information out, but that information will come out to you within a week. And if you have interest in more information on the subsidies, then contact me. Okay, well, it feels like a very quiet group. It's not exactly the most upbeat subject right now, but I appreciate your engagement and you being present. And we are open to conversations and discussion, any of us. You can find our information on the web page that Cami put in there. There's on the sidebar, you can find the staff information. So please feel free to contact us. If I don't see any more hands or any more questions, then you can go off to whatever the hour of the day it is and what you're doing next. But thank you very much for participating.